If you are studying for the NCLEX right now, I am sure you know the feeling. It's kind of like trying to drink from a fire hose, right? There is so much information and the pressure is just immense. But what if you had a map, like a blueprint, that was made by the very people who designed the test? Well, you do. It's the official NCLEX test plan, and in this explainer, we're going to use it to cut right through all that noise and zero in on one of the most critical topics, infection control. So here's our game plan. First, we're going to crack the NCLEX code itself. Then, we'll look at the 4 big categories of the exam, put a spotlight directly on infection control, and then, this is the best part, we'll build your core study list straight from the source. We'll even look at how these questions are actually written and wrap it all up with the key takeaway.
Okay, let's get into it. Instead of, relying on a bunch of third-party guides or trying to guess what's important, we are going straight to the source, the official test plan from the folks who actually make the exam. This is how you focus your precious study time on what really truly matters.
And that's the first thing you have to realize. The NCLEX isn't designed to trick you. Not at all. Its structure is a really well-defined blueprint, and the test plan lays it all out for you. Just understanding this structure is the very first step to walking into that testing center with a whole lot more confidence.
So let's start with the big picture. The NCLEX organizes every single question into 4 major categories called client needs. Think of this as the highest level of our map. Getting a handle on these 4 areas is just fundamental to knowing where to focus all that energy.
Now, what's really interesting here is how this chart just shows you the exam's priorities. You can see physiological integrity is a huge 50% chunk, but look at that next biggest piece, safe and effective care environment, at 31%. This is a massive portion of your exam, and it's inside this category where we're going to find our target.
Okay, so let's see how this builds. We're going to funnel down, taking that big, safe and effective care environment category and putting it under a microscope to find exactly where safety and infection control is hiding.
As you can see, this category is actually split into 2 parts. You've got management of care on one side, but our focus today is on that second part, safety and infection control. The test plan tells us this specific subcategory makes up a very significant 10 to 16% of your entire exam.
So here's the crucial point. This is not some minor topic. We are talking about up to 16% of your grade. By mastering the concepts inside this one single area, you can make a huge impact on your overall score. This is what we call strategic studying.
All right, this is the heart of our explainer. We're about to take those abstract categories from the test plan and turn them into a real, concrete study checklist. These are the specific testable concepts that the examinators say you absolutely must know for safety and infection control.
First up, the absolute basics. The exam is going to test your ability to apply concepts like hand hygiene, aseptic and sterile technique, and the different kinds of isolation. See, it's not just about knowing the definitions, it's about doing. And notice that last one, educating others, that's a key nursing role right there.
Let's just pause on this one because it is so important. Standard precautions are the bedrock of modern infection control. It's this idea that you treat all patients as potentially infectious to protect both them and yourself. You can bet that almost every infection control scenario on the NCLEX is going to be built on this one fundamental principle.
Okay, next up, the test plan broadens the whole idea of safety beyond just germs. You need to be able to look at the entire environment and spot hazards. This also includes promoting staff safety, so think ergonomics and preventing needle sticks. And of course, the main goal, protecting clients from any kind of injury, whether it's a fall or a hospital-acquired infection.
And this concept of safety also extends to the actual materials and equipment you use. The test plan explicitly states you need to know the right procedures for handling biohazardous materials, making sure equipment is used safely, and following security protocols. It's all part of creating that safe and effective care environment.
So knowing the facts from that checklist is essential, but it's really only half the battle. The next-gen NCLEX is all about clinical judgment. It's going to test your ability to apply these principles in realistic clinical scenarios. So let's take a look at a sample question pulled directly from the test plan.
Take a second and read this. This is a classic NCLEX question. It's not asking you for a definition, it's asking you to prioritize, to use your clinical judgment to figure out the biggest safety risk. So who needs that extra attention?
The correct answer is number 1. And this just illustrates the point perfectly.
Why? Well, because Meniere's disease directly causes vertigo and really severe balance problems, which creates the highest risk for a fall. So this question isn't even about infection, but it comes directly from the safety and infection control category because it tests that core principle we just saw on our list: protect client from injury.
So let's bring this all together. Why in the world does the NCLEX spend up to 16% of the entire exam on this one area? Because it isn't just about passing a test. It's about the fundamental mission of nursing itself.
This quote, pulled directly from the test plan. It's their definition of this category. It says it all. This is the job. This is the core professional duty you are signing up for. The NCLEX tests this so heavily because it is the absolute foundation of safe and effective nursing practice.
So as you keep prepping, don't just memorize facts. Use this official blueprint. Focus on these core principles and constantly ask yourself, okay, how does this apply in a real-world scenario? That's how you move from just knowing the material to actually demonstrating true clinical judgment. You've got this.